What is the difference between brain death and coma? People often confuse brain death with coma, and to the untrained eye, they do look similar. But in reality, telling them apart is a question of whether or not one is alive or dead. The brain consists mainly of two parts, the cortex and the brainstem. The cortex does higher thinking, whereas the brainstem controls breathing and is the center of human consciousness. If one's cortex is severely damaged, one can become unconscious and fall into a coma. But since the brainstem controls breathing, while in a coma, one can still breathe. Although occasionally, comatose patients are sometimes attached to a ventilator to help them breathe. Comatose and vegetative state mean the same thing. Comatose is just short-term, 30 days or less, and after 30 days, it's called vegetative state. Sometimes people can recover from a coma and from a vegetative state. Brain death, however, is a whole different story. Brain death is qualitatively different than coma. Brain death means the whole brain has died, both the cortex and the brainstem. Normally, if your brain dies, you can't breathe, you can't get oxygen, and all other organs die. But if you had already been connected to a ventilator when your brain died, your heart keeps on getting oxygen from the vent, and it keeps on beating on its own accord. The heart has its own natural pacemaker and does not know the brain has died. The organism is dead, but its organs remain alive for a few more days. The most important difference between brain death and coma is you can wake up from a coma, but you can't wake up from brain death because brain death is death. Brain death is final, even on a ventilator. Upon the onset of brain death, all the organs, including the heart, will die in a short period of time. No one has ever woken up from brain death. Unfortunately, many people, including journalists, use the terms coma, vegetative state, brain death, and brain damage